Feline infectious rhinotracheitis. The occurrence is worldwide. It's a frequent disease. The etiology is the alpha herpes virus has the varicella-virus genus, which has feline herpes virus 1. It's related to swine herpes virus 1 and bovine herpes virus 1. For the epidemiology, Felidae are susceptible. It causes upper respiratory tract disease, and viremia is not common. It is shed in nasal discharge and secretions, and latent infections occur in cats. Clinical signs can be seen when it's reactivated due to stress, glucocorticoids, or pregnancy. Other factors are winter, age, so younger than 6 months old, or a very old cat, or stress. The disease is highly contagious and it spreads rapidly. For the pathogenesis, you have an aerogenic infection and it replicates in the upper respiratory tract. The replication causes necrosis and inflammation. It affects the eyes, causing conjunctivitis and the lacrimal channel, and it also affects the nose, the nasal mucosa, causing rhinitis and sneezing. For the replication, it rarely causes viremia, but it can cause abortion in the 6th week of pregnancy and causes fetopathy. For the clinical signs, it causes fever. And for the respiratory tract, it causes rhinitis, sneezing, and conjunctivitis, and the lacrimal gland is affected, and it can affect the frontal sinus and cause empyema. Most importantly, it can cause keratoconjunctivitis sicca and phleboritis. The nasal discharge can go from serous to mucopurulent, and it can even lead to blockage with a blocked nasal orifice. It can also block the lacrimal gland and cause keratitis and corneal ulcers. The incubation period is 3 to 6 days, and it causes ulcerative skin disease. For the pathology, we can see rhinitis and pneumonia as a co-infection. In the histopathology, we can see intranuclear inclusion bodies in the tonsils. For the diagnosis, you can isolate the virus with a PCR using nasal swabs. Viral neutralization is not a diagnostic method because it's seropositive, it's widespread. The differential diagnosis is calcivirus, but it has more intensive ulceration. For the treatment, as a symptomatic treatment, you clean the eyes and nose, and you can give IV fluid therapy, such as specific hyperimmune serum, glucose, and for the prevention, you can give an inactivated or attenuated vaccine. It's polyvalent, so in kittens, give it at 7 weeks old and you repeat it.